Hey girl gang, it's Dr. Joy here and you're watching Delivering Joy MD TV. It's Super Mama Sunday and today we are talking pregnancy safe medications for diarrhea. Make sure you keep watching. All right, girls, so let's talk about diarrhea in pregnancy. Diarrhea can be pretty embarrassing, but it can certainly occur in pregnancy and can be related to... All right, girl gang, so today we're talking diarrhea in pregnancy. And diarrhea in pregnancy can be pretty common, especially as you approach your due date and get up into the third trimester. And this can really be caused by new food sensitivities or changes that you've made in your diet that can cause upset stomach. Can also be caused by hormonal changes as well, even sometimes medications like prenatal vitamins. So while diarrhea in pregnancy can be common due to the pregnancy, it can also happen for other reasons. Some of these other reasons could be a viral or a bacterial infection like the stomach flu or a stomach bug. You can also experience diarrhea with food poisoning. We can see it occur with irritable bowel syndrome. So that's something that you had going on prior to pregnancy. You may see that resurface during pregnancy. There are also inflammatory bowel disorders like Crohn's disease that could be an underlying cause for diarrhea in pregnancy. What are we going to do about this diarrhea? First thing I always say is give it a little bit of time, because if it's a pregnancy related cause or if it's due to a stomach flu or something you ate, it's usually going to resolve on its own within 1 to 3 days. But if you get to day 2 or 3 and you're still having diarrhea, it's time to think about other causes. So the first thing I do is reach out to your OB care provider and find out if they would like for you to come in for any sort of testing or treatment, because the main issue with allowing diarrhea to continue for several days is dehydration. So we don't want you to get dehydrated. You want to make sure you're staying as well hydrated as possible. If your diarrhea is accompanied by vomiting, where you're throwing up and having diarrhea, I would reach out to your OB care provider if it hasn't resolved within 24 hours, just to make sure that you're keeping a good hydration status. And in that case, you may need to come in for IV fluid hydration. Take a look at your medications and search the side effects. Sometimes diarrhea is a common side effect of many medications that a woman may be taking during her pregnancy. Avoid problematic foods. So spicy, greasy, fatty foods can also contribute to stomach upset and diarrhea. And if these things fail, oftentimes your OB care provider may recommend over-the-counter medications for diarrhea like Lomotil, kaopectate, or Imodium. And these can be very helpful for short-term use so that you can get some relief from your diarrhea and try to maintain your hydration status. So let's talk about warning signs. If you're having diarrhea in pregnancy and you are going more than 6 times a day, if you're having blood in your stools, if you're having watery, bloody stools, that's a problem. Also, if you notice that you have signs of severe dehydration, it's time to go on in and be checked out. Severe dehydration signs can include really dark, concentrated urine. If you are feeling lightheaded or dizzy, are extremely thirsty, or have dry mouth. These are all signs that you need to get hydrated quickly. So I would certainly recommend either going in to the emergency department or contacting your OB office right away if these symptoms occur. So let's review. Diarrhea can be common in pregnancy, especially in 3rd trimester. Most times diarrhea is what we call self-limiting, meaning that it's going to go away on its own within 1 to 3 days. Diarrhea can be related to pregnancy, and it can also be from other causes. It's very important to check this out with your OB care provider if your diarrhea is lasting more than 2 to 3 days. For home remedies, avoid problematic foods that are like spicy, greasy, fried foods. Also, consider checking your medications to see if diarrhea is a common side effect. Check in with your OB care provider to see if an antidiarrheal medication like Imodium or Lomotil is right for you. Hope this video has been helpful. If it has, give it a thumbs up. Make sure you subscribe so you don't miss any Super Mama Sunday episodes. And I'll catch you next Sunday, girl gang. Peace.